Well, we're back with Dr. Fenderson here from Napa Valley. Dr. Fenderson, we talked about teeth missing and the literally ugly effects and painful effects it can have on head, shoulder, not looking so good, not digesting, and all that type of stuff. Now, and eventually even front teeth, falling out, meaning teeth which are perfectly good, getting shifted. So, what are some of the methods one can fix them once they're already out? Never mind preventing, but let's just say teeth are missing and they have to be replaced. What are some of the methods appropriate to remedy that situation?
At our office, we evaluate all the methods. And actually, one of the methods, if teeth are shifting and crooked, is with orthodontics. Here in our office, we do minor orthodontics called Invisalign, and there's times when I refer to an orthodontist if it's more advanced to get the teeth straight. And another method is to reshape the teeth, and of course, we're talking about maybe filling in back spaces. One of the most modern methods is with implants, implantology, where instead a new root is put in and a new tooth is in. That way you don't have to touch the other teeth. For years, what we did is bridges, too, where we actually made crowns on the two teeth next to the missing spot and then put a false tooth in between a conic, and that's permanently cemented in. And even before that, a lot of the methods were what they call partial dentures, where you have something that snaps in and out of your mouth. We do less and less of those nowadays because of the advancement of implants and the advancement of some great crown techniques or bridge techniques to replace missing teeth. So it can be a combination of orthodontics, of implant specialists, and gum specialists sometimes to get that fixed up, and then a general dentist that does restorative work fixing everything up.
Okay. Well, let me ask you about, let's just say putting in a crown or a bridge, which is basically, one tooth is missing, you're grinding down two teeth on the sides, and you put a crown or a cap on it, and you hang a third tooth in between. That's why it's called a bridge, just like the Golden Gate Bridge. You have two posts, and this other thing hangs in between. Now, that seems to be, of course, a very good method of doing it. And yet the new thing, as you mentioned, is the implants, where you basically put a metal stick in where the tooth was missing, and then put a crown on it. Now, let me ask you, I've heard that when a tooth is missing and the root basically is out, the tooth is missing, that gives the bones a potential to shrink. And when you put an implant in it, with that metal stick, kind of the body thinks and feels the tooth is back in it, and thus the bone doesn't shrink. Is that true?
Yes, that's why I love implants and recommend them highly. Because when a tooth comes out, the first thing happens, the bone starts to shrink down, gets smaller, and actually it can shrink down to a point in some cases where it's more difficult to put an implant in, and we have to add a little bone to put the implant in. And when the bone shrinks down, especially if it's in the front area, and you add a tooth in there, when you smile, that tooth has to be a little longer to fill in the space. It never looks as good. So there are techniques to build the bone back up and put implants in. And what's great about implants versus bridges is it stimulates, as you mentioned, it stimulates the bone to stay hard and to actually fill in and grow, and it doesn't shrink down. So it is a great treatment, and it has been perfected. What I love about implants is they're probably the most successful thing we do in dentistry today. Bridges, there's a certain percentage, 98 or whatever percentage, that will for some reason fail, get decay underneath them, and have to be replaced after so many years. But implants, I have a rare occasion that they fail. Once they integrate and the implant solidifies and you put a crown on it, you can count on that tooth for a long time.
Yeah, and one of the reasons the crowns and bridges have a tendency to fail much faster, which if you calculate that like let's say one lasts 5, 10, or 15 years, and the other one lasts 30 and more years, if you calculate that in terms of money, you're probably coming off actually cheaper with the implant, never mind the hassle of having to redo it. But let's talk about when there is, let's say, maybe not with one tooth missing, but when there is several tooth missing, and one puts several crowns, several bridges in it, or perhaps even a denture, and the bones start shrinking. Is the bone never mind that then it's difficult to put an implant in it and all that stuff, but let's talk about what happens when the arches or the bones shrink. Is that when a person gets that caved in, dried out tomato look? Basically, he adds 5, 10, and 15 years of age to do it. Is that where it comes from?
Yes, if you walk around old folks' home, and I can tell when I walk in which people, even when they're wearing dentures, which people have lost their teeth, and whether replaced them or not replaced them, because indeed, as the bone shrinks, then you do have that sunken in area that comes in. If they can be puffed out a little bit with dentures, they can be puffed out with implants. But it is definitely changes the outside of your smile and your face with missing teeth. You mentioned missing teeth, and we talked about in order to have a bridge, you have to have 2 parts, San Francisco County and Marin County for the Golden Gate Bridge. Well, sometimes there's teeth missing where there is no San Francisco, and so what you'll need is have to wear something that comes in and out, or implants. Implants work great in those cases where there is not an extra tooth to put the bridge on.
Right. Well, anyway, now we talked in another video where a dentist can prevent headaches, shoulder pain, which, I mean, is major. I mean, so many people run around with headache, and personally, I don't really know what a headache is like, except here and there when I eat bad food for a few hours. But it must be bad, because I know I have people around me who kind of like, so if that can be fixed, so a dentist is so far more now, you also become a cosmetic, a plastic surgeon, because you're taking off 5, 10 years of looks, because you're putting in implants, and you don't have that caved face, and you don't need Botox or whatever the hell one gets for that stuff. So again, a dentist is so much more than just fixing a tooth, and I know there's actually more to it in terms of immune system and stuff when it comes to periodontal, and we'll talk about that. And that considered, if you look at an implant versus the other stuff with in terms of price, because the other one eventually fails faster, so it's really not all that much more expensive. It actually may be cheaper. Yeah.
For sure, the cost of the implant and the crown on it is not much more than the cost of a bridge, but in the long run, it's even less expensive, and that's what I often tell my patients here in Napa that come to see me. They say, "Well, I hear implants are expensive." And says bridges and the damage caused from partials over a long period of time is going to cost you a lot more.
Yeah. And the fact of, for instance, on a bridge, right? When you have a bridge, you have like basically 3, maybe 4 or 5 teeth together, and there's no space in between because they're all together, right? Which makes it very, very difficult to floss in that area. Not impossible, because you guys have all these funny instruments like a needle and you go through it. But I have already a problem, just like with eating, by the time I start, when I start flossing with my wife together, I do the showering, the shaving, I do everything, and she's still flossing. So imagine if I have to go through this, difficult thing, which then does what? It creates gum infections in those areas where one has difficulty to floss. Again, is that right?
In fact, when you mentioned that, the flash in my mind is a patient that came in a few days ago that has a bridge, and it was all sore and tender, and she couldn't figure out what was going on. And I had told her and showed her how to floss, but she said, well, I was just brushing around it really good. And when we took the floss underneath the bridge, there was some popcorn kernels and stuff stuffed under there that got caught in the gums. It is a area that takes a lot more energy, as you said, and a lot more time to clean. It can be done, so I don't want to discourage people from getting a bridge. It can be done, but I just want to, I let every one of my patients know that it's going to take more time in cleaning your teeth when you have a bridge.
You're opening the door to have a little accident, which isn't so little happening, basically.
That's right. That is correct.
Yeah. Well, all right. Here we have it: implants versus crowns and bridges, and the ways of, basically fixing your missing teeth. However, the most important thing, I guess, is that you've got to stabilize the teeth which are still there by filling the spaces in between, just like you would put a new fence post in it when one or two of them are missing. Otherwise, you know what's going to happen down the road.
That is true. If it's important for you to keep your teeth all your life, I have a father-in-law that is 100 years old, plus 6 months, and I am just so proud of him. I've been his dentist since we got married 40 years ago, and my wife's father was just in recently, and his teeth they're worn from 100 years of chewing on them, but he has kept the gums healthy, and there's no missing teeth. And we're really, really proud of him. And maybe that's why he's 106 months, because he has such great teeth.
I wouldn't bet against it. From all I know and about with talking with dentists like you, it definitely looks that that the mouth, and we get to that a little bit later, really is keeping it. It keeps so many other things in alignment. Makes a lot of sense. Makes a lot of sense what you just said. Well, anyway, Dr. Fenderson, thanks a lot. Bye bye.
Thank you very much, Helmut. Well, good talking to you. Bye bye.